Good afternoon and welcome to this week's Fridays with Friends. I am very happy to have with me the National Network to End Domestic Violence. We have Ashley Schley, who is the manager of Positively Safe, addressing the intersection of domestic violence and HIV/AIDS. And we also have Rachel Gibson, Senior Technology Safety Specialist. So welcome to you both, Ashley and Rachel, and thank you for joining me.
Thank you for having us.
Thanks.
Yeah. It's nice to see you on Zoom and on Facebook Live now, because the last time we were around each other, it was when you did an in-person training at our office here in Plantation, Florida. So it's been a little while since you were with our office, but thank you again. We'll just start with, if you could provide me just a little more information about the National Network to End Domestic Violence.
Sure. Thanks again, Alicia, for having us. It's so nice to be here with everyone. The National Network to End Domestic Violence is a social change organization dedicated to creating a social, political, and economic environment in which violence against women no longer exists. We work to make domestic violence a national priority, change the way that society responds to domestic violence, and strengthen domestic violence advocacy at the local, state, national, and international level.
Okay, and Rachel, sorry, I was gonna say, can you tell me a little bit about the project specifically that you and Ashley work on?
Sure. So we were founded as a policy shop back in the 90s, where we realized that we had a lot of our coalition, and we served the 56 state and territorial coalitions. And we realized that we needed a place in DC where we could make that kind of connections with law policymakers and law enforcement and legal professionals. And so that's kind of how NNEDV was birthed. And so we have our policy team that works diligently with our legislators to make sure that VAWA, the Violence Against Women Act, VOCA, the Victims of Crime Act, and FIPSA, Family Violence Prevention Services Act, all get reauthorized and funded, making sure that appropriations and that sort of thing goes through. So that's our policy team, and we are so grateful for the work that they do. And then we have our 6 other signature projects. And those projects range from the project that Ashley works on, which is our HIV and AIDS project, the project that I work on, the Safety Net project, where we work at the intersection of technology facilitated abuse and intimate partner violence, our economic justice or independence project that works with survivors and advocates to make sure that survivors are empowered economically. They work with the All-State Foundation to make sure that survivors can get access to loans. We have our microloan project. We also have our transitional housing project that Ashley works with as well, where they work with many of the local programs like the ones in your state in Florida, where they have transitional housing programs where survivors will leave shelter and then begin to kind of rebuild their lives through a housing program that's not immediate emergency services, but long-term services to kind of help them get back on their feet. And then we have our coalition capacity team that supports the 56 state and territory coalitions around leadership, around meeting the needs of the 2,000 plus local domestic violence and dual domestic violence, sexual violence programs. And so I'm sure that you all have had connections with many of our projects. I know one of our other projects that I don't want to forget to mention is our Women's Law project that I'm sure would be interest to your audience, where our Women's Law runs an email hotline with attorneys who can help answer questions. It's not a legal, they can't give legal advice, but they can help you understand the laws in your state. They can help you figure out what injunctions for protections or orders of protections might be possible for you depending on your need. And so they run our email hotline providing that service. So that's a little bit about all of our 7 signature projects here at the network.
It really sounds like a holistic kind of view of what survivors of domestic violence would need with those different services. So thank you for laying all of those out, Rachel. So I'll kind of pick, because you and Ashley are here with me today, the projects that you work on. So Ashley, do you want to start? There is an intersection of HIV and domestic violence Can you tell me a little more about that?
Sure. So our project provides technical assistance and trainings to programs such as yours that Rachel and I came to visit in March. And we really started this because we saw this lack of connection between the two fields. But as you mentioned, there was a clear intersection there. We know that 55% of women living with HIV have experienced domestic violence. We also know that cis and transgender women experiencing domestic violence that are living with HIV have higher rates of antiretroviral failure than those that are not experiencing domestic violence. The HIV status of either the person using abusive tactics or the victim could be used to maintain power and control in those relationships. This could look like, say, the abusive individual guilting the survivor into staying with them because they're sick. This could be that the abusive individual tampers with the medication of a victim or survivor, not allowing them to go to medical appointments. They could also threaten to out the victim or survivor to their family members. So if their family didn't know that they were living with HIV, letting them know, and just making them feel as if this was their fault, that maybe the reason they acquired HIV was because of them. So there's a huge intersection there that we've heard from survivors over the years of doing this work, and how we continue to support them and helping programs understand the need to work closely between domestic violence and HIV organizations.
Oh, very good. And you provided some statistics related to that about the prevalence of it. So thank you for that. That was helpful. Rachel, can you tell me about technology safety for survivors of domestic violence?
Sure. And all of this work is connected. When survivors who are living with HIV and AIDS not only have to deal with the immediate, maybe physical, emotional abuse in their lives, they may also have to deal with the technology facilitated abuse. And so what does that look like? It can look like Ashley said, maybe a survivor being outed about their status online, maybe having their accounts being hacked or impersonated. Maybe it's non-consensual sharing of intimate images, also known as revenge porn. So there's a lot of different ways in which survivors who experience technology facilitated abuse can be harmed. And so we work at that intersection, making sure that survivors understand that they have a right to technology. Every survivor, every person has the right to use technology in a safe and meaningful way. And so we work to make sure that survivors understand that they can use technology to empower themselves. I know many survivors, especially survivors living with HIV and AIDS, have joined forums and groups and chats where they can connect with other folks who are going through some of the same things that they're going through. So technology, while it can be risky, can also decrease isolation and increase access to services and connections. So we have that piece. We also, on the Safety Net project, work to make sure that agencies like yourselves are using technology in a safe way. When we communicate, I know with COVID-19, many programs had to switch to providing digital or remote services. So how do I communicate with a survivor who may be wanting to chat or text or tweet? What does that mean if we have confidentiality obligations? So we not only work to help programs increase access to survivors through technology, but we also remind them of their confidentiality obligations to do that in a way that doesn't share, distribute, or keep information that is not part of the obligations that they have. And so we do that work. We also work with policymakers to help ensure that policies, that laws that are enacted are right for survivors. We've done a lot of work recently with encryption, so making sure that survivors can have access to encrypted data, but also understanding that sometimes, that encryption can make it a little more difficult for law enforcement to get access to information, but helping them understand the ways that they do have access to information, working with policymakers around non-consensual intimate images. We also work with big name companies like Facebook and Twitter, Google, around their own policies and how they can increase safety for survivors who use their programs or their platforms. And so that's a little bit more about the work that we do, and helping folks remember that it is all connected. Well, I know a little later we'll talk about how COVID has affected survivors, and so I'll go in a little more detail about what that connection means for survivors who are now forced to stay home, who can't get access to their medicine because of COVID, and what that kind of looks like.
Okay, and I guess this is really for both Ashley and Rachel, is what is being done to share the information that you have, like for you, Ashley, on your HIV and DV, the intersection? What is being done to share that information either with survivors or with programs so that they're aware of all of the details that you have on it and the research as well?
Yeah, so we present at conferences across the web right now, and across the country when we get back to that, to really help programs explore their own policies and figure out what's missing, what needs to be adapted to make sure we're best serving survivors living with HIV. We also do exhibit booths at national conferences. So we held one actually at the International AIDS Conference in July, and we will be hosting an exhibit booth at the US Conference on HIV and AIDS later this month, as really a way to just get our information out there so people can really start thinking about it and exploring what they need to do. We know that it's it's a process to getting people on board with having that conversation about domestic violence if you're an HIV provider, or having that conversation about HIV if you're a domestic violence provider. And we have those resources that can help. We also have posters and brochures and like little postcards on our website that programs are free to download, and have them, set out at their programs. This is an easy way for survivors to grab information if they're not ready to talk to an advocate, or by posting that poster on your wall, it just lets the survivor know that, hey, this is a place I can, come to if I want to talk about this, if I need information about testing, if I just want to let them know I'm living with HIV, but I don't know how to access medications because maybe I fled my abusive partner. So we're trying all sorts of different avenues. We do a lot on social media as well. We'll have an awareness campaign coming out hopefully in the next few months to kind of highlight the stories of survivors living with HIV, to let other survivors know that they're not alone.
And for the Safety Net Project, we have our techsafety.org. That's TECHSAFETY.org. Blog where we post tons of great resources. We have several toolkits that we've created, a survivor toolkit just for survivors that can help them understand the tactics of abuse that are prevalent when technology is involved, ways that they can minimize their risks and increase their safety. So that's our survivor toolkit. We have our agency's use of technology toolkit for agencies who are now providing services and thinking about what that means for their own service provision while using technology. Before COVID started, we had started creating what we call our digital services toolkit. And that toolkit actually was very, very timely when March came around and we had to all shift our work. And that toolkit, I think, is going to be really important for service providers who are providing legal services, victim advocacy services, using video, using Zoom, using email, using text. And so our digital services toolkit is really helpful for programs who are implementing digital or remote services. We have our confidentiality toolkit that helps service providers understand what your legal obligations are in maintaining the privacy and confidentiality of a survivor. We have our legal systems and our judicial toolkit that are for judges and legal system service providers. Those are two toolkits, and that helps legal providers and judges understand the ways in which technology is being misused and the context and how to help survivors collect digital evidence. One of the things that I always think about is how we had to train train judges about what the emoji, eggplant emoji was and what that means and how that could be construed as threatening or harassing for a survivor when context is involved. And so that toolkit really is for legal systems professionals and our judicial toolkit for judges to help them understand the ways that technology plays a part in the abuse that a survivor may be experiencing. And then we have a lot of other information right now with voting coming up. What does voter privacy mean for survivors who may have fled? We have a relocation and identity project that does that work. And so we've created some helpful tip sheets and handouts for voters and survivors to consider. Contact tracing, when we talk about COVID, and what does contact tracing mean for a survivor whose information is being collected by the government and potentially shared? And what are the risks to that? And what are the risks for programs who have to report if a survivor may be experiencing COVID-19, but their legal obligations they can neither confirm nor deny? And so our techsafety.org blog has a wealth of information for many different aspects of what technology means for survivors and service providers.
Oh, thank you both for that. When Ashley was speaking, I was thinking about that HIV is not an easy topic. There is still a stigma that is attached to it. And when you add the layer of domestic violence, the same with the stigma that it's attached to it. So the intersection of those and the information that's out there, the website that she mentioned, that's going to be posted in the comments for anybody that wants to look at that information. And then the same for Rachel, as you're talking about all the technology, we're still having remote Zoom hearings here in Broward and many other places around the country, of course. So that is something that judges, lawyers, case managers, survivors, everyone has, had to be on board with that, since March. So this is all very timely, and important information. But the websites and information that Rachel listed will also be in the comments on Facebook. So for anybody watching that wants to get more information, you can just look in the comments for the links to that. Do either of you have something you want to wrap up with? We're getting a little close to our time. If you want to just talk about any specific COVID information for it, we can wrap up with that. Do you want to start, Ashley?
Sure. So the National Network to End Domestic Violence, starting in March when everything drastically changed, we launched a rapid response to COVID. We have a number of resources on our website, which I think will be posted in the comments as well, that include what Rachel has mentioned, the technology safety and how do you kind of shift to digital services, but also a lot of the responses like around PPE and, just supporting staff during this difficult time. So we have a lot of information online that you can access. But it's a challenging time that we're all working through. Survivors are being put in very difficult situations. Many have lost their jobs, which includes the loss of income, the loss of income as well as healthcare, and then having to take care of maybe their children. So we have to be open and supportive to them. Domestic violence shelters continue to be open, and service providers continue to accept survivors. So if anyone out there is needing support, contact a local domestic violence program or the hotline.
And I think I just end with, as even though COVID-19 may have changed the way we do our work, it didn't change the core of our work. We're always going to be survivor-centered. We're always going to empower survivors, and survivors should have access to services. And so while that might look a little different in terms of what that access means, we will always remember that we are survivor-centered, whether we're attorneys, whether we're law enforcement, whether we're national service providers, or even community members. Survivors are the experts in their lives. And so we are just here to support them through that. And so we continue to do the work that we do by being empowered and empowering survivors. And so from us at the National Network, we want to thank you all who are doing this work on the ground, because we can't do the work without you. And we will continue to support organizations like Coast to Coast and Broward County and all of the great resources and information that you all do. So we applaud the work that you all do every day by supporting survivors. So thank you all.
All right, thank you very much. And for anybody watching, we'll post the contact information for family and domestic violence for our program at Coast to Coast if there are survivors who are watching and need assistance. And I want to thank again to Ashley and Rachel for joining me and providing all of this information. It was a bit of short notice, but they jumped right in and were ready to go. And again, great to see them since the last time was in March, just before we went remote as well with COVID. And for everyone watching, thank you for checking us out today. Be sure to like or follow us on Facebook at Coast to Coast Legal Aid, and stay safe and stay well. Thank you.
Thank you.